Hi everyone, I want to talk about diagnosis of sore throat or diagnosis of pharyngitis. Okay, let's go. To start with, first thing first, history and physical examination. If the clinical features of pharyngitis complications are present, you can check my first video on sore throat or pharyngitis where I've stated all the possible complications. So if you are able to pick any of that, then refer to emergency room immediately or inpatient setting for additional care. But if that is not the case, if the history and physical and clinical features are also suggestive of viral etiology, then we give supportive care for about 7 days. If one above is not the case, but you are suspecting group A streptococcus with the clinical features like fever greater than 38 degrees Celsius, sudden onset, or tonsillo-pharyngeal or uvula edema with patchy tonsillar-pharyngeal exudates associated with tender cervical lymphadenopathy or scarlatiniform rashes, and the history of group A streptococcus exposure is present, then do RADT. What is RADT? Okay, you know that right now. RADT means rapid antigen detection test. In this case, we are detecting the antigen. This is an immunochromatographic assay that is very rapid in detecting the presence or absence of an antigen at the point of care. Results are available immediately. About 95% will be specific but less sensitive. CLIA waived tests are available. It is specific to group A streptococcus antigens, not antibodies. Throat culture is more sensitive, but we do RADT first. If RADT is negative in children and adolescents, you can follow up with throat culture if required. If RADT is positive, then you don't need culture right now, just give antibiotics, broad spectrum. If RADT is negative, then you can give supportive care, but if RADT is negative and you are strongly suspicious that there's a bacterial infection ongoing, or this individual is a member of a group home or school dormitory, or there's an acute rheumatic fever or immunocompromised, or this person had close contact with someone who could have harbored group A streptococcus bacteria, then do throat culture right away. If throat culture is positive, give antibiotics. If throat culture is negative, supportive care is what you're going to do. If clinical features are not classical of a group A streptococcus, or you are not certain, then you can use what we call Cantor criteria to determine whether RADT should be done or not. And how do we go about that? Okay, you take the temperature. If the fever is around 38 degrees Celsius or greater, that is 1 point. If you do your physical examination and you check the tonsils and the pharynx and you find exudate on them, that's 1 point. You check the cervical lymph nodes and you pick lymphadenitis, that's 1 point. The history of cough, if there's absence of cough, that's 1 point. If the score is greater than or equal to 3/4, perform rapid antigen detection test right away. If the score is less than 3/4 and he or she is living in a hostel, having rheumatic fever, immunocompromised, or having contact with anyone that is immunocompromised, then do throat culture. If not, give only supportive care. If score is less than 3/4 and not in above state, rule out respiratory viruses, HIV, gonorrhea, or mononucleosis. Throat culture is about 95% sensitive, more sensitive than rapid antigen detection test. Can identify group A streptococcus, group C, group G, and others. Results will be back within 24 to 48 hours. There's what we call molecular assays. So we've talked about rapid antigen detection tests. We've used Cantor criteria. We have talked about throat culture. Now we want to talk about molecular assays, and that will involve two processes. So you can have what we call nucleic acid amplification test, or you have polymerase chain reaction. If you use the standard molecular assays, the standard molecular assay is expensive but highly sensitive. You're going to get results in 1 to 3 hours. It is final, which means no follow-up culture is required, even if you are taking this in children. You are still talking about molecular assay, but it could be nucleic acid amplification test or polymerase chain reaction using rapid molecular assay. The rapid molecular assay is like the first that I described, the standard assay, but this time you're going to get your result within 15 minutes, not 1 to 3 hours. And this will be performed at the clinic, not at the standard laboratory like the first one. And there is what we call CLIA, that is Cruise Lines International Association, that's the body. They have what is called waived test that is commercially available. So you're going to get it done quickly. And with that, I've come to the end of diagnosis of sore throat. That will start with history. I make a determination of which one to go to emergency room immediately, or you do rapid antigen detection test. If you are still confused, use your Cantor criteria to make that determination. If you are not convinced with the report that RADT is negative, if you think it should be positive, have your throat culture done. And if you are not okay with that, go for molecular assay, nucleic acid amplification test or polymerase chain reaction, depending on whether you do rapid molecular assay or standard molecular assay. Thanks for listening to my presentation. Kindly subscribe to my channel so that you can get these presentations immediately they're published. Thank you.